Hi, good evening. Thank you for joining us. So, our organization is called Just Humans. We hold a monthly seminar series to educate on different types of inequities faced in South Carolina. And tonight, our topic is on food deserts, nutrition, and how it impacts our health. I'm our speaker, Rebecca Bishop. And to overview our organization just a little, we are a research to action organization engaged in ending systemic inequities within all communities. So we use empirical biological research methodologies to actually investigate the health impacts that occur due to housing, food, and different types of health inequities in vulnerable communities. We were founded on November 18th in 2024, and I am the founder and president. Once again, my name's Rebecca Bishop. I have a master's of science in genetics from Clemson University Center for Human Genetics, as well as a bachelor's in genetics and several research publications as well, which is what led me into founding this organization. Our topic today, once again, is food deserts and nutrition. So we'll explore how access to nutritious food shapes our individual and community health, especially here in South Carolina. And we'll begin by understanding what food deserts are, how they affect us here in South Carolina, how they impact our health, and what can be done to change this. There will be questions asked to the audience during the seminar. If you're able to speak, that would be fantastic, and time for questions from the audience at the end of the seminar as well. And this should only last about a half hour. I very much want to respect everyone's time on a Thursday evening. So first, I'd like to start out by defining what food deserts are. Food deserts to some may be a very arbitrary and even novel term. Food deserts are an area where residents have limited access to affordable and nutritious food, especially. Typically, these are areas lacking supermarkets or large grocery stores that are within a convenient traveling distance. And we'll get more into what these barriers look like and the types of problems that occur because of them. There are a lot of shared common features of food deserts. They're often in low income urban neighborhoods or rural areas as well, where there's just large commutes in front of actually reaching a grocery store or any type of fresh produce. They're characterized by a high density of fast food and convenience stores with very limited healthy options, let alone affordable healthy options. And then there's a lack of transportation or walkable access to gain fresh foods. And this can be very different in individual lives and within different types of communities. It's very important to understand the distinction that food deserts do not equal a lack of food, but equal a lack of healthy, affordable, and culturally appropriate food on top of it. A quick question for the audience before we really dive into the materials, and it's totally okay if you're not willing to share. That's very much acceptable, but I'd like to give the chance just in case. Have any of you ever lived in or near a neighborhood where you couldn't easily find affordable fresh produce? I know I can give a personal example. I live in Greenwood, South Carolina, which is very much on that kind of urban rural divide. There's a lot of it's urban, but there's a lot of surrounding rural areas. And say, even on Highway 25, which goes from Greenwood to Greenville, South Carolina, there are plenty of homes on that road that are located a solid 20, 30 miles away from the next grocery store. And so that to me very much represents a huge barrier in actually accessing fresh produce when the only thing within 5, 6 miles is a gas station and a fast food restaurant. These individuals might not have the ability through having a car or even the affordable means to fuel the vehicle to make it that 30 miles to a grocery store. And so these individuals would definitely be experiencing a much bigger barrier in actually obtaining proper nutrition. So, what do food deserts look like in South Carolina? On the right, you can see an image of the state with all these green boxes indicated throughout it. Each of these green boxes are areas identified by the USDA, and this is from 2018 data of actually actively documented food deserts within South Carolina. And this is generated through census tracking data. And what's most important to take from this map and from this data is that every single county in South Carolina has at least one census tract that's considered being present within a food desert. And there are 46 counties and over 5 million individuals in South Carolina. So that leaves a decent number of the population that's facing these barriers to nutritional access and the negative outcomes that it produces towards their health in particular. To overview a little bit more of the active statistics for food deserts in South Carolina, roughly 17 to 20% of South Carolina's population lives in a low income, low access food area. And the counties with the highest concentration of individuals per like census tract defined as being within a food desert are within Allendale County, Dillon, Bamberg, Lee, and Williamsburg. I've kind of mentioned that there is a rural and urban divide that takes place. And what this looks like is rural areas often lack full service grocery stores entirely. They are these areas that are far removed from the cities where there's 20, 30 plus or miles to travel to even reach a grocery store. For urban areas, low income neighborhoods may not have or may have stores, but they don't have healthy, fresh, and above all, affordable options that low income and housing cost burdened individuals and communities can take part in. Income and transportation access greatly exacerbate this divide as well, placing individuals with even bigger barriers to overcome to accessing fresh and affordable produce. Take just a second to kind of picture living, let's go back to the example of 25 and living 20 miles from a grocery store, but maybe you make 15,000 a year and you don't have a car. This is a huge barrier and divide that you might face compared to others around you in that area. And so, who is impacted most? Where do these inequities within food disparities most often occur? In South Carolina, it's in Black and Latino communities who are most disproportionately affected, the elderly and disabled individuals who often lack transportation and personal physical mobility, as well as low income single parent households who can greatly struggle with affordability and access. And so, what are the health impacts of food disparities? We've kind of mentioned that that's where we're going with all of this, is that these inequities are contributing to health outcomes in individuals, families, and communities at more endemic rates. Food deserts directly contribute and have been well documented and studied to have negative health outcomes within affected communities. Poor quality diet has been studied and shown to be directly or have a direct metabolic impact on the body and directly relates to these types of health disparities that occur within these communities. These impacts accumulate and then contribute to health disparities that impact affected communities at a much higher rate. And this ultimately results in what are all preventable conditions that are linked to poor nutrition that impact these communities in more endemic rates, such as type 2 diabetes, hypertension, obesity, cardiovascular disease. Iron deficiency anemia, which most in particular impacts children that are raised in poor nutrition and low food access areas, as well as certain types of cancers like colon and breast cancer. To expand on this idea of these health outcomes from poor nutrition access and these inequitable divides, type 2 diabetes often occurs from a nutritional standpoint from higher processed sugar intake as well as processed carbohydrate intake. And it's documented that it's 2 times higher in low access areas. Hypertension occurs from high sodium and low potassium and has been directly shown to be linked to fast food dominant areas. Cardiovascular disease results from excess saturated fats and low dietary fiber. And what's even worse about this is it's the number 1 killer in South Carolina, and so much of the endemic rate within these communities is preventable simply through better nutritional access. There's obesity, which occurs from caloric surplus, or caloric surplus in particular within the processed carbohydrate, sugars, and other processed fatty food worlds. As well, these food deserts tend to have limited access to exercise opportunity. And it is well known that this is more disproportionate in marginalized communities. Iron deficiency anemia is from an inadequate iron intake from whole foods in particular, and this is very common in food insecure children. Certain types of cancers, like colon and breast, occur from processed meats and very low produce consumption. And this is all the more heartbreaking because this is very lifestyle modifiable for when these cancers occur from a nutrition based avenue. And then cognitive decline and fatigue from a lack of omega 3s, vitamin B, and vitamin D. And these are signs of chronic malnutrition and can greatly impair children in particular over the years. These kind of effects have long-term consequences. So, how does this happen biologically speaking? Poor quality diets impact the body's metabolic function from the processed sugars, saturated fats, processed carbohydrates, and high levels of sodium. And these can hijack the metabolic system in ways that it's not supposed to function. It can smother the metabolic system in ways that hamper its appropriate function. And poor quality food has been shown to disrupt insulin processing, contributing to the different types of diabetes outcomes, have extreme impacts on cardiovascular health, lead to disruption of cellular function due to increased cellular stress from different types of oxidative factors. It disrupts the immune system and results in gastrointestinal and mental health issues from microbiome alterations. And our microbiome is the collection of bacteria that lives within our mouth and our gut and helps maintain different parts of our overall health and function. And this can actually directly correlate to cognitive function as well. The gut brain barrier right now and how nutrition impacts the gut brain connection is very much a growing field of research. To finally expand just a little bit more before we kind of start wrapping up into what can be done, insulin resistance from these processed sugars contributes to diabetes. Systemic inflammation is what contributes to cardiovascular disease through the processed carbohydrates and poor nutrition. Oxidative stress to the cells contributes to increased cellular aging and DNA damage. And this DNA damage ultimately impairs the ability of the cell to repair itself, continue to divide properly, and maintain adequate healthy function within its cellular state and capacity. It leads to microbiome disruption that produces gastrointestinal and mental health issues once again. And these nutrient deficiencies, above all, create weakened immune systems, result in fatigue and cognitive dysfunction that can have varying extremes of impact dependent on age and other different genetic background factors. Ultimately, once again, this is about disparities. This is about the communities that experience these issues at much higher and more endemic rates and have bigger systemic barriers in front of them in order to actually overcome these disparities. Black and African American South Carolinians are documented because of this type of food disparity to have a 1.5 higher rate of diabetes and obesity, and it's all linked nutritionally. And they also have increased hypertension and stroke risk. Latin and indigenous populations show elevated chronic disease prevalence that is very much directly tied to poor food access. So we've kind of seen that ultimately poor nutrition equals poor health, and systemically marginalized communities experience this poor nutrition divide at higher rates. But how does proper nutrition act as a preventative? And yes, I apologize, lost myself for a second. So, what does proper access actually look like? As defined by the USDA, grocery stores and farmer markets must be within a 1 mile access point for urban located individuals and 10 miles for rural. Anything outside of those boundaries starts to fall within the food desert definition. Proper access to nutrition looks like affordable whole foods like fruits, vegetables, legumes, lean proteins, and whole grains. And that affordability is the key stressor component to accessing those whole foods. Proper nutritional access also looks like nutrition education. And this is towards communities and occurs through farming co-ops to increase urban agriculture systems and community gardens. And it looks like more transportation and delivery options for food insecure residents, whether these be mobile grocery stores or different types of food justice organizations that might help mediate picking up groceries from a local grocery store and then shipping them to these individuals who are facing different types of transportation and financial access barriers to get to those grocery stores. So, proper nutrition equals proper health, but what does proper nutrition look like? We've seen a little bit now of what proper access is defined as, but okay, now I can access proper nutrition. What's my plate of food supposed to be? What is my healthiest option? This is an ongoing topic that's continuously muddled and confused by this nutritional science that's coming out with the next fad diet, and acai berries are the next superfood. And this is a fundamentally flawed science because at the end of the day, human population sizes are far too large and genetic diversity is far too diverse. Genetic backgrounds impact to metabolic function is highly, highly intricate. And so it's better to think more, how should my plate be divided rather than certain volumes of calories and things like that, because that is ultimately super personally dependent. So your proper plate, as defined by the USDA, should be a half a plate of fruits and vegetables. A quarter of it should be whole grain, some kind of rice, legume, a good, nice whole wheat noodle. And then the last quarter of that plate should be comprised of a lean protein source of some kind. It's very good to add in a dairy or dairy alternative option as well to try and increase healthy fats, proteins, and vitamin D and calcium intake as well. And ultimately, always shoot for the water over the sugary juice or the soda at the end of the day, especially when eating. It's very important. So, what are the benefits ultimately of proper nutrition? We've seen now what better access to nutrition is defined as, and we've even seen what a more or less proper plate of food should look like according to the USDA. So, what are the benefits if we follow through with this? And we provide this access and opportunity in particular to communities that don't currently have it. It results in preventing disease onset and reducing the ultimate severity of diseases that do have nutritional components but aren't ultimately caused by poor nutrition. It leads to improving mental health and school and work performances, which allows individuals to strive and achieve better in their life, which ultimately increases the quality of nutrition that they can provide themselves access with. It reduces maternal and infant mortality rates, which ultimately reduces healthcare costs. It reduces burden on foster care systems. So the benefits to that aspect alone are profound, and it lowers long-term healthcare costs and reliance on emergency care. And this doesn't just have impact to individuals, families, and communities, but this has an impact to the state as a whole. By reducing those overall healthcare costs, we can ultimately reduce the overall amount of state spending that goes into those healthcare costs for these preventable conditions. To look at an idea of the estimated impact of reducing healthcare costs and why using proper nutrition as a preventative and reducing that inequity across the board is so fundamentally important. The DPH of South Carolina has identified that improving food access can prevent 1 in 5 cases of diabetes and up to 30% of heart disease related deaths. Now, 1 in 5 cases of diabetes might not sound that much to you, but let's look at what that means in actual numbers and population size here in South Carolina. In 2020, there were 556,000 cases of diabetes that were costing the state an average of $16,750 per person. And this is from the DPH library site indicated down at the bottom of the screen. Now, if we reduced 1 in 5 of those 556,000 cases, we would ultimately reduce 110,000 cases of diabetes in the state of South Carolina alone. Now, when you take that over the 16,750 per person that the state was spending in 2020, that means we could have reduced state spending for healthcare costs by 1,842,500,000. And with South Carolina's debt deficit being 13.1 billion, being able to reduce our healthcare spending in the state upwards of $1 billion a year could have significant impacts on increasing the prosperity and the ultimate prosperity of the state and how it is burdened by its overall debt deficit. As well, the state of South Carolina could save millions in Medicaid and Medicare costs as well, further contributing to the reduction in state debt deficit. And this occurs purely through preventative food program policies. The investment for these types of programs is nominal compared to the actual overall amount of annual state savings that can be realized once these programs are fully fleshed out and functioning. So, what ultimately are the solutions and what's the call to action for all of this? We've seen how poor nutrition impacts certain communities in more endemic rates, and this leads to more endemic health care outcomes in these communities. But what can we do to solve this? How do we bridge that gap? How do we help provide better nutrition access and education to these different individuals and communities? This can occur at community level interventions, such as better support for mobile grocery stores, increase in urban agriculture, fighting for increasing subsidized produce programs like SNAP benefits doubling when used to obtain fresh produce and whole foods, and then partnering with local farms to further increase community gardens and urban and rural agriculture development for communities that are experiencing food disparities to learn job skills and help provide better whole food access to their communities. It looks like policy level actions, which can occur by pressuring local and state governments to incentivize grocers to move into food deserts and actively reduce the distance that those individuals have to travel. It looks like advocating for providing transportation vouchers so that those individuals that do have large commutes in front of them to get to a grocery store can help subsidize some of the cost of that commute that they're losing from their grocery bill. It looks like expanding SNAP and WIC benefits and reach as well, so that individuals that need and rely on these programs can better utilize them to gain access to proper whole foods and nutrition for their families. And finally, it looks like personal advocacy. Attendees here and anyone watching the recording can volunteer for food justice organizations. You can contact your state representatives about food access programs, and you can work to host community food drives or educational workshops, especially by reaching out to food justice organizations. They can really help guide you on how to do this as an individual or how to pair with them through volunteership to actually help increase their platform and success with their own programs. So, quickly before we wrap up, who to contact if you are interested. Some local food justice organizations in South Carolina. We have the South Carolina Food Policy Council, which is statewide and advocates for equitable food systems. We have the Mill Village Farms in Greenville, which participates in urban farming plus youth job training. As well in Greenville, there's the Feed and Seed Company, which creates food access and farmer aggregation as well to increase that educational opportunity within communities and the startup of community gardens and farming co-ops. In Charleston, there's the Low County Street Grocer, which functions as a mobile farmers market. There's also the Charleston Food and Nutrition Coalition, which advocates for collaborative policy work to actually create legislative impact surrounding legislation that moves through South Carolina that might have a negative impact on these individuals that are experiencing these large barriers to proper nutritional access. And in Columbia, South Carolina, there's Food Share South Carolina, which creates affordable produce boxes and distributes them statewide. If you're interested in contacting any of these organizations, their contact and website is located here to the right of this table. This recording will be uploaded to YouTube if you're not able to get any of these written down, and to our registered attendees as well. We will be sending out handouts at the end of this seminar to cover some of the key points we've taken away from this seminar, and one of those will be this slide so that you'll have access to this information. So finally, I'd like to open up with a Q&A session. In case there are any questions, please feel free to ask. Please feel free to share your stories. I'd love to hear from you. If you're here in person, we'd love to hear from you. And if you're watching our recording, please comment below. We'd love to hear about your experiences. And above all, we'd love to know, did we leave anything unmentioned? Are there avenues of this topic that we might not be aware of? Because I myself love ongoing education and would love to know better so that I can better lead just humans to educate communities as well. And then finally, will anyone act after this talk? And with that, the floor is open. All right. Well, thank you so much. I really, really do appreciate you popping in tonight. It definitely means the world to us as we get on our feet and try and get these seminars out there. I would love it if you enjoyed this seminar, if you might advocate for our organization to some of your friends, families, and coworkers and help spread the word and have individuals go watch some of our other seminars on YouTube and join some of our seminars here in the future. Thank you so much for being here with us tonight, and I hope you have a wonderful evening and a very healthy, yummy dinner.